Coming up, we'll be on location at Modern Orthodontics in Bristow, Virginia, discussing the latest advances in orthodontics and how they can straighten your teeth and improve your smile in less time with one of this region's top orthodontists, Dr. Nick Mollov. Dr. Mollov completed his DDS degree from Virginia Commonwealth University and is a member of the American Association of Orthodontics. He is also widely recognized as one of this area's top orthodontists. Welcome, Dr. Mollov. It's a pleasure having you on our program.
It's a pleasure being here.
It's your first time, in fact, on the Top Doctors interviews. We have a lot to talk about. We're going to hear from a couple of your patients a bit later as well. But I wanted to begin, if I may, Doctor, by having you please tell us about the different types of orthodontics that are currently available, as far as from conventional braces to lingual braces, Invisalign. There's a whole host of options that are really, through the advancements in technology, are providing some great results.
We do all of the latest technology orthodontics in this office. Like you mentioned, lingual braces is one of the modalities that we use. Those are braces placed behind the teeth. We're also one of the premier Invisalign providers in the area. Invisalign are clear aligners that move teeth very gently and gradually. We also do regular braces, traditional braces that people are familiar with, but they are much smaller and a lot more gentle now than they were before. And lastly, we also do ceramic clear braces. Those are a variation of the clear braces, but they are a lot less visible than the traditional braces.
And you know, one of the benefits of the clear braces, the Invisalign that you just touched on a moment ago, is for those, whether you're young, you're old, or anywhere in between, a busy professional or just a homemaker. A lot of the times when we have braces, traditionally, everyone knows we have braces, right? But the clear braces, the Invisalign braces, they're literally invisible. It's like our teeth are getting straightened, the results are coming along through the process and the treatment, but yet you can't see the braces in most cases.
Correct. What we try to do is provide the best treatment for our patients. We personalize every treatment plan, and it's not just getting the teeth straight. We realize people have lives outside of here. We try to make the treatment comfortable for them.
Yes.
So whether it's invisible braces or traditional, whatever fits that person, that's what we try to do for you.
So you basically customize the treatment plan according to each patient's needs.
Correct.
Wonderful. And what types of problems do these various orthodontic treatments that you offer here help people with?
So in orthodontics, we call the problems malocclusion. The different types of malocclusions we treat are overbites, underbites, crowded teeth, spaced teeth, or any sort of jaw problems that patients may present with.
So quite a few people would fall under that.
Correct.
And just to elaborate a little bit more, Dr. Mollov, what would you say are some of the key benefits or differentiators from where the orthodontic treatments are today, again, through the advancements made possible through technology, as opposed to, say, before, as far as what everybody always remembers, the traditional braces?
Right. When people think of orthodontics, I feel like they think of uncomfortable impressions, big bands, lots of metal in their mouths, extractions. Those are all things that we've gone away from. We have a scanner that we use to have a mold of people's teeth, as opposed to the impression materials. We almost never take teeth out, and our braces, like I mentioned previously, are as invisible as possible.
Some great benefits indeed.
Yes.
Great, better results in less time, right?
Correct.
And again, I'm sure this next question would depend on each patient, his or her situation, but in general, how long do these treatments typically take, would you say?
Again, it varies based on the patient. They can go between 6 months to about 2 years.
Okay, again, like you said, depending on each patient.
Yes.
And what type of results are your patients experiencing, Dr. Mollov?
So we aim for perfection here. Orthodontic perfection is defined by the American Association of Orthodontists, but for us, it's getting to the result that each individual person wants. When I do a consult, I try to figure out what the patient wants, and our plan is catered to that goal.
We're now going to hear from a couple of patients of Modern Orthodontics and Dr. Mollov. Welcome, Tanya. It's a pleasure having you on our program.
Thank you for having me.
We always appreciate it when patients take time in their busy lives to come down and share some of their experiences with us. And on that note, I'd like to begin, if I may, Tanya, by having you please tell us what initially brought you here to Modern Orthodontics.
Well, I had two front teeth that were misaligned, and then I had a molar on the lower left side that used to cause me a lot of discomfort. So I came to Modern Orthodontics to see what I can get done.
Oh, so then you came here, and then I take it you met with Dr. Mollov and some of the staff initially during a consultation?
I did, and Dr. Mollov was very thorough with the way he explained his treatment plan with me. His staff also let me know everything that would be done and made me feel right at home from the moment I walked in.
Well, that's an important thing, right? To feel comfortable, especially when you're going to a doctor's office or a dentist's office. Mm-hmm. And so you went through the process, and then what was the treatment plan that they suggested for you?
So Dr. Mollov recommended braces. He recommended an extraction of a molar, and then would bring the molar behind it in place to close that space up afterwards.
Oh, interesting. And then you had all that taken care of?
Yes, I was in braces for about 1.5 years. He fixed the two front teeth that also made me feel self-conscious of my smile.
Now you feel great again, right?
Of course, yes.
There you are. Look at that. You're beaming right now. Wonderful. And for the folks out there watching, I take it you're very happy with the results?
I'm very happy with the results of my teeth, my smile. I'm happy with the people that worked on it. Dr. Mollov did an awesome job, and so did his staff.
And before we let you go, Tanya, is there anything else you'd like to share with our viewers?
I would definitely recommend this office. It's very modern, it's very kid-friendly, and it's very tech-savvy. So I had a lot of fun and a really good experience for my braces.
It really is state-of-the-art, isn't it?
Yes.
All right, well, on that note, we'd like to thank you, Tanya, for joining us, sharing some of your experiences, and being a guest in our program.
Thank you. I appreciate you guys.
Welcome, Andrea. It's nice having you with us as well.
Thank you.
I wanted to begin by asking you if you can tell us what dental problem or problems were you experiencing, Andrea, that brought you here to Modern Orthodontics?
Well, I was experiencing a lot of crowding in my teeth. I had a little bit of jaw pains, and I had a little bit of a problem with my bite because of the alignment of my teeth.
So then you came here, and then what happened after that?
I chose to go ahead and start treatment, and I got braces.
Oh,
I
see them right now.
I ended up having to get extractions, meaning I got a couple teeth pulled, and yeah.
Well, your braces look great. So how long have you had them on now?
I've had them on for almost a year.
So how much longer, basically?
Hopefully, fingers crossed, I have about 6 months left.
And that's it?
Yeah.
And then then your teeth are going to be just perfect, right?
Yes,
all
they are.
aligned and proper and everything else.
Yes.
And what has your experience been like here with not just Dr. Mollov, but the whole staff at Modern Orthodontics?
It's actually been really great. The staff is they're sweet, they're really helpful, they answer all my questions, and I just love them.
And I take it you're happy with the results?
So far, I'm ecstatic.
Oh, and before we let you go as well, is there anything else you'd like to add?
I would highly recommend Dr. Mollov and his staff because they're just really great.
Well, on that note, we'd like to thank you as well for joining us and being a guest on our program. It was our pleasure having you on, Andrea.
Thank you so much.
Thank you, and good luck on your journey.
Thank you.
All right. We're now back with the doctor. I must say, Doctor, both Tanya and Andrea were very happy with the results. Some great work indeed. And from our research, we found these results are typical of the kind of results your patients across the board are experiencing.
Yes, they are.
And I know, again, this would depend on each patient, but I wanted to ask you, for as far as follow-up visits go, and again, I know this depends on the treatment they had and the level of extensive work or not each patient requires, but generally speaking, do you recommend your patients coming back every few months, every 6 months or so, just to see where things are?
Right. We bring our patients back every 6 or so weeks to
Okay.
monitor how everything is progressing. And once we're done and we deliver their retainers so that their teeth are still straight, we bring patients back every few months.
Okay, great. Just to see where things are,
Yes.
like you said. And for folks out there watching, I know you touched on this a little bit earlier in the interview, but who would you say, Dr. Mollov, would be a typical candidate that can benefit from the many different treatments you offer?
Everyone's a candidate. If you want to have your smile be better, you're a candidate. We can see what we can do for you and make that happen.
All right. Certainly good to know.
Yes.
It does pretty much include everybody, you're right, from kids right on through adults. Now, are there any age restrictions? Speaking of kids, is there an age, like a minimum age, that you recommend before a child can start seeing an orthodontist?
Not really. We want to see kids at the age of 5 or 6. However, treatment may not be started until later, depending on what's going on with that individual patient.
Okay. And again, I know this would depend on the treatment and also would depend on the patient and how they maintain themselves moving forward after treatment. But what would you say, are these results permanent as far as the various options you offer and the results that follow?
Yes, they are. We take great care of our retainers and we follow up on our patients after treatment is done to make sure everything stays exactly how we finished the case.
All right. Well, we're literally out of time, Dr. Mollov, but I wanted to ask you before I let you go, you and Modern Orthodontics here in Bristow, Virginia, in Prince William County, have certainly established a reputation for excellence. You're one of this region's top orthodontists, and I just wanted to ask you what you feel helps separate you and your practice apart from many of the others.
We do an amazing job as orthodontic in an orthodontic office. However, I feel like we connect with our patients. It's not just about getting their teeth straight. It's about providing personalized care and giving patients what they want.
Yes, and it's not just you, it's your whole staff. I mean, the patients we spoke with earlier, they love you all.
Yes, they do.
That says a lot. And what I love also is how things have changed from when someone like myself and other similarly aged folks used to go to an orthodontist. I mean, back then you had the white offices, right? The stale looking, typical, traditional type of medical or dental practices. Now I walk into your practice and it's like a dental spa. I mean, it's beautiful, it's state of the art, it's so modern. It really takes a lot of the stress and the anxiety, I would imagine, away when people walk in here with you and your wonderful staff. It's really, you've done a great job and you're helping so many people in this community. A job well done, doctor.
Yeah, we want to make it more than just straightening teeth. It's an experience and we want to provide the best experience for our patients.
And hence the name Modern Orthodontics, right? And on that note, we'd like to thank you again, Dr. Mollov, for joining us, educating us, and being a guest on our program. It was our pleasure having you on.
Thank you for being here.
Thank you.